Okay, well, good morning. Welcome to Fireside Chat. It looks like a surgery center here. Everyone's got their masks on. So when does the surgery start? Well, it's good to have everybody here. Not everybody, of course, but we got this hybrid model going where we have some people here and we have some people that are seeing it live stream. Trying to get back to our normal flow, so hopefully this is the kickoff of what will be increasingly more normal because it feels a lot better to be in the room with one another. I want to mention too, be sure everyone sticks around. Lori is going to have some very important news to share with you when her turn comes up. You're all going to want to hear it. So you can, this way you can let me drone through my stuff because some good stuff is coming a little bit later. The first thing I want to do is I want to thank George Counts for his role in the COVID task force. I mean, really, this man has been a sincere, true value add to everything that we have done. And it has been an incredibly collegial relationship where it emphasizes the difference between us and other communities when we work so well with residents who have expertise in areas that we really need. And it has just been a total joy. He was a colleague, he is a confidant, he is somebody who we can punt to in difficult times. He really stepped up, and he's decided that, 2 years, kind of enough, it's a big job. He's retired, right? But he kind of wasn't retired for 2 years. But he has worked with Finley Wallace to step in to be that healthcare, he's a physician, so another healthcare voice on our COVID task force. We'd love to disband the task force, but guess what? We're not out of the woods, so we need it. And it's really great to have a resident who is helping us to make decisions and to communicate all the stuff that we communicate. So thanks, George, and welcome, Finley. All right. I wanted to touch a little bit on some information you received earlier in the week. You can switch the slide there. Master planning and strategic planning. I kind of tried to explain in a fairly brief way kind of the distinctions between the two in terms of what is master planning, what is strategic planning. And we will begin with early in October having Mithun walk everybody through what the master planning game plan is. You're going to like some of it, you're going to not like some of it, you're going to have ideas, you're going to have input. The point is we want to get it out there, get people to take a look at it, take it in, and then begin to kind of refine it so we have a game plan that will get underway for actually making it happen. So then later into November, and we'll have a strategic planning session where we'll walk everybody through what the strategic planning committee and what the board of trustees have been working with over the last 18 months, 19, 20 months, whatever, and kind of what some of those conclusions are and what that means for the organization and how that involves you. And that in turn is going to have lots of topics and issues and things that people are going to say, yeah, but what about this, so on and so forth. Lots of meetings all through 2022 to make sure that we are able to answer questions, take in input. You'll be a part of that process. And again, that's what we do here. We make people a part of the process. So those are some things to look forward to. We also received information this past week on some reorganization. We try to, as an organization, be responsive to when things aren't working quite as they should, or we think they should work better. A lot of that comes from feedback from residents who say, hey, this doesn't work that well, or we'd like to see more of this, less of that. So we have two things that we're doing that we shared with you. One is reorganizing that front desk reception area and having that report in through Risa. So Risa will be kind of taking over that, plus a number of other things that she is already doing. And I think that will be welcome and helpful, and that will report into Brian Holtz. We discovered that reception area really, especially in a COVID environment, has become much more of an operational role. It really does have to work like clockwork, and it fits better in an operational component than it does more in just a general communication area. On the communication side, we are looking to get a communication manager because we realize, from feedback from residents, how important our various channels of communication are, and that we really need to make sure that we're offering, it's accurate, it's timely, it's effective, and it's actionable communication. And sometimes you got to reorganize it and get concentrated talent. I think Laura's done a great job of pulling lots of people in to make it help happen. And we think that maybe, that pulling in all those pieces, we need to concentrate and have it really be under some specific leadership. So a communication manager would be driving that, assessing our channels, prioritizing the channels, ensuring the content is clear, and so on. So we're looking forward to that. And of course, that is, kind of leads into the next big thing, and that is it's hard to get people. And it really is. I mean, this is a national problem. This isn't just a Horizon House issue, but it all bleeds into Horizon House. So I kind of want to give you my top 10 reasons what I think is happening in the labor force across the country. It's not all happening here, but some of it does bleed into Horizon House. And there's a reason I want to keep repeating this stuff is so that you understand that when things might not be working properly because, well, gee, you're understaffed. Yeah, we know. Yeah, and we'd like to not be. We're performing very well financially, but for the wrong reasons. The wrong reasons being that we save money on labor cost because we can't hire people. That's not a good reason. We're not interested in saving that money. We're interested in having those people plug in to better serve the audience, and we can't get the people. So, just kind of looking through some of these thoughts of mine anyway, and they're from, these are from experts. I'm not totally making this stuff up. I make up some of it, though. I want you to know I do make up some of it. There's continued COVID fears. In the marketplace in general, people are unsure, uncertain. We take a very safe approach, but, there are people who are fearful, and that's legit, and that keeps them out of the labor force. This is really a big one. Accelerated retirements around the country. People got forced into retirements, and you could say, well, okay, well, they were retired, so what? Well, the point is when it got accelerated, there's an awful lot of spots to fill, which means now you're just competing for that much more talent when there's a lot more opportunities for people to take, and that presents a problem for us. This is mine. I'm not making this up, but I do believe that the 40-year contract, or I should say that we used to have a contract with employer and employee relations where it was much more mutual. And I remember when I started in my career, I could see the turn, and we've spent 40 years where that shift has gone towards the employer, where the employers made all the money and the employees not so much. And I think we've kind of reached the end of that road. We in this industry, Horizon House in particular, haven't been that kind of an employer, but it doesn't mean you're not affected by it. So I think we're seeing that employees now are saying, no mas, I'm not going to work for free. I'm not going to be subject to things that I don't like or I don't want. They're taking a stronger position. And to tell you the truth, I don't blame them one bit. And we still need to have people. Pay is a part of the equation, and we address a lot of that pay, and we will continue to address pay. I do not believe that pay is our impediment to getting people. I think there is just a big shift in how people are looking at employment in our country, and that's playing a bigger role. We are more than willing to offer up pay, and you're going to see some numbers in a second that indicate that. Work-life balance. Sometimes people are just saying, you know what, I really just don't want all that stress. I don't want to have to deal with that. I'm willing to just do something a little bit different in order to have the work-life balance. Well, again, people who would otherwise choose our industry might not be choosing our industry. The healthcare and senior living burnout, the care in senior living, it does cause burnout. It's a lot of heavy lifting, and you all know what that means when, staff are here for residents who are in need of care. It's a lot of work. And sometimes people just get burned out. I see it. I was, been spending more time at the doctor's office than I should because it's my leg thing. And, you just see it on their faces. They're just tired. They're exhausted. So they're making choices that maybe healthcare isn't where they want to be, and it bleeds into senior living. There are a lot of choices out there too. I mean, Amazon's going to hire 125,000 people, Kroger 20,000. All companies are looking to hire lots of people. The demand for services and products are there, but the labor to support it is not. We don't know when that will come into balance. And that really means that, we do need to be really smart about how we allocate technology and people, because if we are exclusively people dependent on everything, then it just makes that problem that much worse. So we have to balance, where can technology help us sensibly and add value to the equation, and where doesn't? Where do people matter most? I would say immigration makes a big difference too. I mean, we represent 29 different nationalities, and when you shut down immigration and say people are coming from blank, blank, blank whole countries and don't want people in here, you're taking people out of the market who naturally are inclined to serve our residents, and that is very disturbing. You know, there is legislation out there that is encouraging states, if this passes, that there will be programs to train people in our industry. And I applaud that, and that's good. But there's another component to that that's missing, and that's temperament. You have to have it in you to want to care for others. That's more than a skill training. So, you know, yes, that's a good thing to see if we can't train more people to be serving in our industry. But to tell you the truth, there are certain nationalities, ethnicities, where the core value in their belief system is to care for others. Those are the people we want. And those are the people that are fewest and far between in order to be able to get. And then the cost of getting to work, you know, coming into a busy city, it's getting tougher. Yeah, we can, ameliorate some of that with, pay for parking, pay for busing, pay for whatever. But then there's just the time you spend. You know, it's a time sink to be sitting on a bus, on a train, on a whatever. So those are kind of the things that are keeping us from getting there. And it's not to say that we're just going to be victims here. We are going to do more. I think there is a paradigm shift for employers to be more important to their workers, which means we need to engage more deeply with our staff to be a higher value add to them, where they look to us to help them navigate a complex medical issue, help them navigate a legal issue, help them navigate a career path, help. So we are more important than the other employer who may not be paying attention. And we're going to spend a lot of time doing that over the course of the next couple of years, because I don't think this is going away anytime soon. And we will outsource things that we can't insource. I mean, when you come down to a staffing challenge and you can't do something because you can't get the staff, then you got to find a resource out there that can do it. So we have to balance that. You don't want to outsource your thinking, and you don't want to outsource your core competency, but you do want to outsource those things that can legitimately be outsourced to other people who have a better way to attract talent to their industry to serve us. And we discern that very carefully. And the developing the lower labor-dependent models means you're using technology where you should. You don't have people running around posting signs, all up and down elevators all the time. You have other tools that do it so that labor can be used in a more judicious way. So, again, I know I'm repeating myself, but it bears repeating because this problem isn't going away. And the more you understand, the more you appreciate and can have that in your thinking as we talk these things through. Continue. We and you as residents do a fantastic job of caring for and appreciating our staff, and I just want to applaud it and say do more. Acknowledge good work and outcomes, when they occur. Assume good intent. We screw up all the time, but it's not because we're like, evil-minded people. It's we like lapse, like everybody else. So assume good intent and be patient, be kind, be forgiving. And when you have something that isn't working, yes, bring it forward. It's all about the how. If you come to me with the issue, or to Lori or to Christy with the issue, and you can lean on us pretty heavily and we're not going to feel bad. But if you lean on somebody who is at a different level of the organization, well, it just kills their day. It just makes them dispirited. We're the ones who have to take that burden, and we want to take that burden. You can have any kind of hard conversation you want with me about something you're not happy about. Same with Lori, same with Christy, because that's our job, is to help understand it, get it to a neutral, and then find a way to improve it. So hopefully that makes some sense. Next slide is, I thought this would be really interesting. This is a slide that shows the curve of the increases to Social Security over the years. And while it hasn't been finalized, the current expectation is that Social Security will increase 6.1% for 2022. Okay, that's the biggest increase in something like 40 years. Okay, so there's two parts to this equation. One is, yee-haw, isn't that great, finally? Now let's go to the next slide, because that tells us a little bit why, okay? So the increase in the cost of living adjustment for Social Security is the product of rising costs. That it is responding to a problem, and now that problem is revealing itself. So just for us in particular, our 2022 budget is going to have an hourly wage increase built into it of 19%. Big number, big number. And you know what? We're not probably done. That means that we have budgeted for what we think is going to happen, but guess what? We may find that, we may not compete for the same customer, the same resident among our peer group out there, Mirabella, Skyline, whomever, but we compete for the same employee. And you cannot be, you have to be a price leader or a labor cost leader if you're going to want to get the best talent. And we're going to have to continue to do more in order to attract people. Total wages will increase nearly 16%. I mean, these are huge numbers, huge numbers. Now, the pandemic has created a lot of supply chain cost increases. We just got word that Cisco is going to go on strike, so that's going to present a problem for us. We got a call 2 weeks ago from Charlie's Produce, said they were cutting our deliveries down by a third because they don't have drivers and they don't have some of the product. Okay, we got to work around that. So when you see a menu change and a big X out of something, it's not because, Jeff or Barry or Chef Steve, decided they didn't want to put something on the menu. They got something pulled from them. Something didn't happen. Something didn't work. So we have to navigate this in a way that works for all our residents. And I just want everyone to know what we're facing behind the scene so that you know why some of these things happen. And it doesn't mean that there aren't issues you shouldn't bring up to us, but there is a core challenge behind all of what we're doing right now that we want you to know about. The food costs alone are going to be in that 10 to 20% range increase. We've got paper goods supplies that going up like 25%. I have personally been waiting for a drawer for our refrigerator since May. It has been out of stock on back order, and we're talking about a regular run-of-the-mill appliance, produce drawer. Why? Because things are backed up all around the world, and it accrues to us. Other costs that are just a part of COVID is things that now are getting government regulation. We're just going to see more regulation, and a lot of it is good, and some of it is, politicians love to stand up there and say, we're saving you by having this regulation. Well, maybe they're not saving anybody, but they are giving us a lot of work to do. But, we've got these, OSHA has said that, you have to have training for the N95 mask on how to put on a mask, okay? And they estimate, we don't think this will be our case, but they estimate it's going to be $500 a person, okay? That kind of training. I mean, it's like you have to go to school to learn to put on a mask. Apparently, OSHA thinks we need to do that. We may have to do periodic testing at the tune of like $30,000 when we have to go through this drill. Test kits, having them available, another 10 grand. Booster shots, 25,000 around, if we are to have somebody come in here and provide booster shots. Now, will all those costs materialize? No, it's just representative of what's happening in this pandemic environment that we operate in. To tell you the truth, I think we've done a hell of a job in being able to operate successfully in this environment, and you can count on us to continue to do that, but it is not without its obstacles. So that's kind of all of my stuff. More good stuff to follow. I want to introduce Erica, but should I've gotten out of the groove a little bit here. Are there questions here about anything that I've spoken? I know I spoke about a lot of stuff kind of fast. Yes, Jean. Yep, microphone is on its way. I forgot. We can ask questions of the studio audience now.
Sorry, I understand the percentage cost, but the dollar cost when you down the bottom when you say periodic testing here might cost 30,000. That's
yeah.
To Horizon House.
Yeah, specifically. Right. Yeah, okay. That's specifically to us.
Thank you. And
right.
This would be if you are testing employees and the booster shots also for employees.
Yeah, that's all about us. That regulation cost is all about us.
Not residents.
Oh yeah, no, we're not passing it on to you. We're going to absorb that cost.
No, but the testing would be testing of residents as well as booster shots?
Could be. It depends on what the situation is. Sometimes we're testing residents, sometimes we're testing staff, sometimes we're doing both.
Thank you.
Yeah. Okay, Erica, you're up next. Thanks. I'll be back a little later.
Good morning, everyone. Good morning. Nice to have you all here today. I've never been in a live room with a bunch of live people, so this is very exciting. So I wanted to share with you just a new program that we actually did a soft rollout in July. My intention was to actually really promote it in August, but then we went back into a quarantine. So I'm going to talk about it a little bit today, and you'll be seeing more information about it coming out. But this is about a new program called the Memory Cafe. Memory Cafe is a program that we started Saturday afternoons, every Saturday from 2 to 4, and it is intended for all residents who are feeling a little bit of cognitive challenges, a little bit of isolation, a little bit squishy from the almost 2 years of COVID, but also for their spouses and allies, eventually family members and paid caregivers as well to come and attend. And the purpose of Memory Cafe is to help people get together, form a community, find sympathy with each other, and bolster each other up, so that when we find that we're having some problems with cognition or other deficits, we tend to isolate. We tend to say, you know what, I'm not going to go to that poker game anymore. I'm not going to go to that bridge game anymore. I'm not going to have a meal in the dining room because I just don't feel comfortable. I don't feel like I can get along. I'm just going to retreat back into my apartment. And the point of Memory Cafe is to help us all work together to be kind and participating with each other. Okay? The first hour from 2 to 3 is a physical component. We're going to do a lot of physical work, usually some kind of exercise component, a lot of singing, a lot of dance movements, things like that. We take a break, and the second half is about playing games, competitive and cooperative engagements. We'll be doing volunteer projects as time goes on, but it's an opportunity for people to practice things that they might have forgotten about that will cause people to have a sense of joy and purpose and wonder again. So hopefully this will be a one time a week that will carry on through the rest of the week and keep building as time goes on. So I encourage you all, whether you think you have, does anybody in here think they have any kind of memory issues ever? Anybody? You're all welcome to come and join us, all of you. So come on down, we'd love to have you and see what it's all about, okay? We really want to build a good community with this way. Yes?
How are you going to staff it?
How are we going to staff it? Excellent question. So I am that is an excellent question. I'm starting it, but I'm also building a mini army of volunteers. Which are you? So it's intended that everybody gets competency and we all become able to basically run it ourselves over time. That's what the intention is. Yes?
Where do you meet?
Excellent question. Okay, every Saturday from 2 to 4, we start on the B1 level at in the gym studio, and then we move to the TV room at this point in time. If it gets too big for that, we'll figure out where we're going to move at that point. That'll be a nice problem to have. Any other questions? Well, feel free to drop by. It's casual, and we'd love to have everybody come and just participate. Thanks, everyone. Oh, wait a sec. Jeff Townley, let's have it coming on up. Dining services. Thank you.
Thank you. All right, thank you, Erica. How's everybody doing today? Good. All right. Well, we move to the first slide. We always like to kind of start off with some pictures of our latest thing, and we closed out the barbecue season this year with a nice Labor Day picnic. I think we had about 150 plus residents come through that day, so that was a really nice turnout. Lovely weather, and as we can see, well, we got some sun coming out today, but it's starting to turn. So probably won't be doing any more barbecues till next year, but you know, you never know. So moving on to the next slide. So just wanted to bring up, I'm going to be talking a lot about buffets today. So we've been doing the weekend brunch for the last several weeks when we weren't in quarantine. And, you know, it hasn't been huge turnouts for that, but the people that have come out have really enjoyed it. There's a lot of different items to choose from. You know, we're a little short staffed now, so that's part of the reason why we're doing these buffets, and it really works out well. And so come down and check it out, you know. And then on to the next slide, keeping in the buffet theme. A lot of you know last night we had to shift gears real quick and throw together a quick walkthrough buffet. You're going to see that the next few weeks on Wednesdays and Thursdays, stuff like that. We've been, just like Mike was talking about, really hit hard with the short staffing issue. Last night we only had one cook in-house, and so we just wouldn't have been able to accomplish cooking all the food in a normal sit-down environment with the everyday menu, so that's why we had to shift gears on that. And we'll be doing the same thing tonight. So we have the prime rib buffet going on, and that'll be the only thing we can offer. And then next Thursday and Friday as well. But those will be in the menu packet we put out today, so there'll be more information about that. And you know, we'll get through that. So moving on to the next one, just talking more about the industry challenges, labor shortages, like we said. We're down a couple servers. We're down some cooks right now. We're trying hard to hire. I do have a new server we'll be starting hopefully next week. We almost had a new cook hired the other day, and some things fell through with that. So we're trying really hard. We got the referral and sign-on bonuses out there, and I know the unemployment benefits have ended. So we're hoping that helps bring some people towards us. Also, Mike kind of alluded to that we just got news yesterday that Cisco, who's our biggest food provider, is probably going on strike today. So that's going to really impact the food deliveries that we get. So we'll do our best with that. Like I've said last time, you know, Chef Steve has been going to the store almost every other day, getting whatever product he can. And even the stores we go to for that are now starting to dwindle in their supplies as well. So, you know, bear with us over the next several weeks and months, hopefully not that long. You know, Espresso Explosion has been out for several weeks now. I know that's a big favorite amongst everybody. And we honestly, we want it back as soon as possible. We get asked all the time, and we're trying, you know. We have the almond fudge, espresso almond fudge. I know it's not quite the same, but give it a try, you know. Onion rings too. We haven't been able to get onion rings on the truck for the last 2.5 weeks. And you know, I've had a few people say, well, why leave it on the menu? Well, we don't want to take it off the menu because it might show up tomorrow and we might have it available. So, you know, bear with us on that. Also trends. We just, you know, something Barry and I talk about a lot is we look for trends. And you might have noticed we don't have the survey slips at the front desk anymore. That's because with the open table, there's abilities for you all to leave reviews there. And we definitely look at those reviews and we look for trends on those, and we try to improve when we do see trends that can be improved upon. One example is on Tuesday night, we had the sweet and sour duck, and that was one of our busiest nights in a long time in the dining room. And we sold out of the duck, and we had many rave reviews about it. And then at the end of the night, we got 2 emails within about a minute of each other, one saying how amazing the duck was and it was great, and the next one about how horrible it was. So, you know, there's 350 to 400 residents. You know, we're trying to, you know, please, and we're not everybody's gonna have the same taste and likeness and everything. So, you know, we look for trends. If we would have seen 15 people saying the duck was bad, then we'd take a look at that. So just want you all to know that we do take your feedback seriously, and we want to improve where we can. So the next slide is kind of just perfect of what we're dealing with right now. Wednesday night, the night after the duck, was another really busy night for us. We were down a dishwasher that night, and I was serving tables, Oliver was serving tables. We go back and Barry's behind the dish area washing dishes for us. So I thought that was really big. I don't have a picture of Steve, but he's on the other side in the dish area helping out as well. So, and that sort of thing, I think just shows the great leadership we have from those two, and the staff really sees that, and that really helps lift the morale of the staff and everything. So definitely big kudos to Barry and Steve for providing good leadership for us. And then the last one, kind of moving towards what's going good right now, is we've launched a new computer system. You might hear the term point of sale or POS, and what that is, that's the computer and the software that we use to ring in all of the food and orders from the bistro. The salon uses it, the garage uses it, finance uses it to run reports and bill everybody properly, and it just kind of keeps everything together. And it's a brand new system. It's geared towards senior living facilities, so it's a really good program. You probably noticed the servers have tablets now that they can ring up your order right at the table, send it to the kitchen, and then move on to the next table rather than having to run back to a terminal and ring it in and go back and forth. So it's really, as they're getting used to it, it's really providing an extra step of service there that's really good and helping us get through these times when we're short-staffed. The new technology coming with that, Brian's going to speak a little bit to this when he presents as well, but there's going to be an app coming out that you can track your balances and do different things with that. There's going to be a lot of new technologies with this coming that will make things a lot easier for everybody. So we're about a month into it, and to me, the system's working fantastic, and the staff's really getting behind it. And so I think it's a good thing we did, and moving forward, it's going to really help improve things. So I think that's all I have to say. Are there any questions for me? Yes, Mr.
How are the weekly menus distributed, particularly to those of us who don't have a computer?
Yeah, so a couple weeks ago, we made the decision with Horizon House to align more with their communication department. So the menus are now distributed digitally. We don't stuff them in all the boxes like we have been doing. We're saving a lot of paper that way. We do know that there are some residents that do need the hard copy still, so there will always be copies at the front desk. And we also will always keep some copies in the bistro and at the host stand. So, if you do need one, please just stop by one of those areas and pick it up and help us just continue to. Yeah, we're going to do them in the mailroom too. Okay, yeah. There's a little back and forth on that, but yeah, so we will put those in the mailroom today. So.
With Cisco out, are you going to have to go to maybe Costco for some items?
That might be an option. I don't know if that's something we've looked at yet, but I'm going to have the boss man come up here and speak to that maybe.
How's everybody doing? All right. I was actually just telling Mike in the back, once I heard about the Cisco strike, first thing I did was reach out to US Foods, which is a huge food supplier. And I wanted Mike to speak to this later, but I'll say now, US Foods told me that they are not taking on any more clients, just like Macrina, the local bakery, when I wanted to get bread 2 months ago. They don't have the drivers, they don't have the manpower, and that's what it is. We reached out to Horizon House finance team yesterday and asked for an increase in the spending limits on Chef Steve's card. He puts a lot of miles on his car going to it used to be cash and carry, and now it's the US Foods Chef store. Chef Steve and I met with the general manager of that store. His name is Rob, which is on 4th Avenue, 4th, right? Yeah. He's a cool guy. We've been going there for so many months. He's going to be able to help us order, so we can order a pallet from him. Talked to Mike yesterday. I said, what's the biggest truck you got? I don't know if my wife will let me drive her Denali up here. But so trucks, vans, and we're going to have to get it done. And I am going to reach out to Merlinos today. I used to work for Restaurants Unlimited and use them at like Fondi and Palisades and Palominos and stuff like that. So I'm going to reach out to Merlinos today. And then I guess the last resort would be Costco. Yeah, I don't know. But I just wanted to say that. Jeff didn't know all that. So thank you all.
Thank you. Any other questions?
I have another
Yes.
What extra support are you getting?
What extra support are you getting from Morrison at this time of crisis?
Well, I think Morrison, we're all in the same boat. So generally, Morrison does have like a labor pool that we could pull from with people that are available to work in other areas, and there's just nothing in that labor pool right now either. So, Morrison, just like every other business in the country right now, is in the same boat as us, that we're all struggling to find people to bring aboard. So, oh, Barry's got something to add to that as well.
I hope again. So with Morrison, some of the things that they've really helped us with in particular, and Chef Steve, is developing a relationship with Cisco prior to this strike talk and Charlie's also, is things like outages there. We're getting emails daily of if, a few months ago we would wait, we didn't know if delivery was coming. We'd call and it'd be Cisco is supposed to be here Monday, it'd come Tuesday or Wednesday, and we wouldn't even know, and we'd have to call. But now they developed a system with them, and they'll let us know, you can check it online and see if you can find out when his orders are coming, things like that. Having these relationships with these huge companies is one of the biggest things that Morrison provides to Horizon House. The ability to recruit someone like Shayla, the registered dietitian, nutrition care manager here, and the support that she receives on her end in assisted living, that's one of the biggest parts that I see that helps Horizon House, as well as the labor pool. There's apps on our phones. We can post a niche shift, like washing dishes with Steve. I can post a shift, hey, we need a dishwasher tonight. In the past, that would have been great when everybody had employees, but it's there if someone wants extra work. I know they need help at the stadiums for the Seahawks game last week, and Morrison was able to do that, and there was some people that actually went to work for that because they want to see the game. And it's things like that, Ms. Olga. So product shortages, there's nutrition, there's chefs, the regional chefs all work together, the menu rollouts and things like that. There's just a lot of collaboration. I get a lot from them as far as, I've only ever been in this community. I've never been anywhere else, but I spend a lot of time. I don't have social media. I'm a lot like a lot of you. I'm kind of a unicorn in that world. But there's a workplace app by Facebook that Morrison has, and it's all the 400 plus communities around the country, and I can read and see and reach out to others and how they're handling problems, and that's really beneficial for me as well. So without actually going to these places, I think that about covers it for now. I don't know, and maybe they don't mind. Yeah. Yes, ma'am. Oh, I thought you said something else. Oh, sorry. Was that all? Did I answer your question?
That's all.
Yes, ma'am. Thank you.
Next up, I believe, is Lori. So.
Thank you.
Good morning. I have a question. How many of you enjoy cooking? Wonderful. We're going to sign you up to help in the kitchen. So Barry and Jeff, take note, you have some volunteers. We want to try out some of your recipes. So we do truly appreciate your patience as we work through and navigate some of these very real challenges, certainly not only here at Horizon House, but across the country. This is all over the news. I want to assure you that we are working very closely together as a team to support one another, because I know that some of our staff are working a lot of hours, and that's where your patience comes in so very helpful, even as you bring concerns forward, because we do have staff we're monitoring to try to prevent that burnout. So thank you for supporting the team here and exercising your grace and patience. So I've got a couple of quick updates before I introduce one of our new team members. One, how many of you had an opportunity to go to the Fall Prevention Health Event, the fair this last Tuesday? Wow, was that not fantastic?
Yeah.
Yes. A huge, huge thank you to Sue Shaw, who orchestrated the magic of bringing together vendors and businesses and staff and residents. The Wellness Committee was a big active part in that. The Wellness Clinic was a big active part in that. Certainly Ryan and Erica helped to support that function. It was just a delight to see so many great business partners come together to learn how they can best support all of you. And we want to continue those efforts as to how we can continue being more proactive in fall prevention. There's a number of falls here, believe it or not. So at the right time, we'll share more statistics. It's not just happening in assisted living. Falls are happening across the campus of independent living residents. It's pretty staggering. And so we'll share more data in the coming months and talk through more about what some future plans can include to try to keep everyone upright and off the floor. I also want to just piggyback off of what Mike shared about George Counts. He is just a gem for me and has partnered, and we've worked shoulder to shoulder. We've had a lot of conversations outside of the virus task force. We've had phone calls in evenings and on weekends throughout the pandemic, just wrestling to the ground as each new situation presents yet another twist. And so I feel that I'm losing a colleague. And while George has been so gracious in saying that he is absolutely available, we also want to honor and respect his moving on to a new chapter in his life. So I want to just go on to say how grateful I am for his leadership, for his collegial working relationship, and he is just a joy, an absolute joy. So I'm thankful we'll get to still see him around the house as well.
Stand up for us. Could he stand up for us newbies?
So George Counts, the question is, could he stand up? George Counts is out of town. He really got on his way to a new chapter. Yes, we did let him know that we were going to formally acknowledge him today, and he said, how nice, I'm not going to be there. But I encourage all of you, when you see George Counts, to please give him a personal thanks. I know that that would be really treasured. I'm excited to move on and introduce one of our new team members. I'm sure it doesn't feel so new right now because Ryan Schuler has just jumped right in there, our new wellness director. Have you all had the chance to meet Ryan? Hopefully a lot of you have. I'm going to bring Ryan up to share a few remarks. It's been just a delight to have you with us, Ryan, so come on up.
Hi. That was my picture, but I actually feel like I get to do my face unveiling today. I was just telling that to Erica when I sat down. I said, you just have such a lovely face, because I've had all these meetings with some fabulous employees so far, but I've not seen them this part down, which has been a great surprise today. It's been wonderful. But yes, I've been here for a little more than 2 weeks. I came over from Emerald Heights in Redmond and was there for about 7 years on their fitness department. My background is in just all sorts of exercises from, actually, if any of you have read my bio, my long-winded bio that I wrote here, when I started at Emerald Heights, my first supervisor sent me to Horizon House within 3 weeks to get certified in aquatic therapy in your pool downstairs. So I have been here before, and since then I have been a fan from afar, knowing employees that have worked here and also staff and residents who have friends here as well. And once I kind of got involved in this process, they all said I would be foolish not to come here. And it's been nothing but spectacular so far. I've met many great residents as well as staff. Had a lot of meetings where we were only supposed to be meeting for a half hour, and then me and Erica got talking for 2.5 hours, 3 hours. So it's just been really neat to know that the culture I was expecting is even more than I can expect. But so my background is everything from in the pool to on the ground, teaching balance, mobility, flexibility, strength, power. I've been in this game for a while and I really enjoy it. It is a fun niche of mine. And I continually learn, and that's not only through classroom settings, but also through all of you and knowing what your needs and wants are through my department. And speaking real fast to my department, she's not here right now, but I wanna make sure everyone gives Margaret a great send-off. Margaret has been here 13 years and her last day is next Friday. I am very sad she's leaving because she is a brilliant, passionate individual, and I've watched her work with some of you. Fall Prevention Fair, just the the connection she makes is very special. So I've learned a lot from her, and she's going to be part of the process too when I'm looking to fill her position, not replace her, because that is impossible. But just to make sure that everyone has a warm outlook when they see her, because she's going on to really bright things, going to start teaching soon, but she's an incredible person and also professional. That's kind of my long-winded introduction. Did I touch on everything? Does anyone want to know anything about me? I'm originally from Indiana. Came out here when I graduated from Purdue in June of 2013. Got in a car with my dog, and then my husband got in a car with the litter box and our cat, and drove 3 days out here, 3 12-hour shifts. And serendipitously, my parents just started the road trip out here this morning. My parents are going to be out here and stay out here for a month. And they're doing a week-long trip. So, and they don't have a litter box in their car either. So fortunate on their part, just a small poodle. But yeah, that's a little bit about me. I'm a very open-minded, creative individual, very much an open door policy. I believe in the creative process, and I believe in bringing everyone's views into it. I'd be silly not to lean on your experience, whether it's residents or staff, when I make decisions here. So you'll always be part of the process. And I'm always someone who could stop in the hallway and I will talk to you at any time and make time for you. So yeah, I think that's it. Or lose my breath. Yeah, thank you so much.
Thank you, Ryan. All right, moving on, just another couple of updates before we move into COVID. One is, if you haven't had the opportunity, I hope you will soon be able to swing by down on B1 to Infinity Rehab. We have a fairly new occupational therapist who has joined the Infinity Rehab team, Priscilla Hung. She is a delight. She is in a company with our physical therapist, Divya and Naomi. And so it's really a gift for us to have occupational therapy services here. In case you don't know, my background is I'm an occupational therapist, so it is near and dear to my heart, and they can provide a lot of services. Priscilla has already met, for example, with the low vision and hearing challenge committee members. There's a lot occupational therapists can do to support through compensatory strategies, through adaptations for low vision, or hearing challenges, certainly for those who may have some balance challenges related to underlying disease processes such as Parkinson's, certainly for individuals who may have some memory loss or cognitive changes. There are a lot of strategies that occupational therapists can deploy and work to help support mitigate some of those challenges and changes. So I just want to really make you all aware that that service is available for you here at Horizon House. So Priscilla will be starting to provide some forums in the future on some specific disease processes and how occupational therapy services can help support that in terms of general adaptations. The other thing I want to just add on to that is I applied for a support for a proposal to the University of Washington Master's Occupational Therapy Program, where I'm also on faculty. I provide education to some of those students, and I'm on the advisory committee at the UW, my alma mater, and they got accepted the proposal. So I'm going to be working with 5 graduate master occupational therapy students to help provide some additional support here at Horizon House, more in the vein of balance and mobility, doing some apartment assessments, to look at some standards we could consider around adaptations, home safety, looking at some educational handouts, perhaps some videos. So a lot of exciting opportunities as I work with this group of students over this next fall and spring summer terms. So stay tuned for more of that. They were hoping to be here on Tuesday, but it is the University of Washington's break right now between summer and fall quarters. So they all had different plans. And then flu vaccine updates. I am really thrilled to share that to date, 160 residents between independent and assisted living have received the flu vaccine. So great progress. Some of those were off-site. Let's see here. I just got some data from Amy in the clinic. 27 of you received your flu vaccine off-site. 133 of you received your vaccine yesterday with Bartels. We have one more on-site flu vaccine clinic by Bartels that's coming up on October 14. There are some spots available, so please sign up if you haven't already, or don't already have an appointment with your care provider offices. I know some of you are getting your flu vaccines at doctor appointments. Call the clinic if you're interested, and a reminder to please be sure you take your Medicare card or supplemental insurance card to the clinic that's needed to register you for a flu vaccine for October 14. I want to also let you know, just as a reminder, we have a mandatory flu vaccine policy for employees. So that will be another requirement, and we are also establishing some on-site flu vaccine clinics for employees to make that easy and accessible. So that is going to be underway. COVID. The topic we just can't get a break from. Unfortunately, just as I was sharing with the virus task force yesterday morning at 9:30, I said, we have our Horizon House COVID chart back to 0. I think we're going to get a little breather, and I jinxed it. I'm glued to my phone for a reason, and I will share that in just a moment. So we did realize 2 more cases. I got notified about 11 o'clock yesterday of 2 independent living residents, as you hopefully saw in the communication yesterday. This is the darn virus. It is sneaky, it is clever. These residents fully vaccinated. These residents had actually received their boosters as well. Yeah, wow. About a week and a half ago, and they still got it. They are very mystified, both residents, as to what their source was of transmission. They are baffled. And so I have been in contact with both of these residents. They are just so sorry about this occurring, and they feel badly and never want to put, of course, anybody in the community at risk. They are in isolation. One does have some symptoms, the other does not. I will remain in close contact with each of these individuals. And so I just have to emphasize again the importance of mask wearing. I'm seeing some masks right now below noses. It is critical that those masks remain up over noses and mouths for the best protection. Continue the hand washing, continue when you're outside of Horizon House, physical distancing, especially if you are not clear what the vaccination status is. So that is why King County Public Health did support us not going back into shutdown yesterday after careful contact tracing with both of these infected residents, tracing what their activities have been during their infectious periods, given the good behavior and practices and protocols we have in place. King County was comfortable with us not having to roll back any guidance, but as we know, that's always subject to change depending on the activities and how infiltrated into the community the individual who may be infected has been. So we will stay close and hope to see both of these individuals recover fairly soon. They, of course, will remain in isolation. In terms of, let's see, governing bodies. So I know that I have reviewed some of this last year, but so much information going around. Who says what? Who directs what we must do? So just to frame it up very briefly, CDC, as we know, Centers for Disease Control, they hand down, they're the overarching body who hands down the guidance and the recommendations around COVID. From there, the states are responsible then for taking that information and understanding what are we going to do within our own respective states. So there have been times here in Washington state where Governor Inslee has chosen to be more restrictive than the CDC guidance. An example of that was around travel. So CDC have put forth general recommendations around travel. Governor Inslee imposed some stricter requirements around travel into Washington state. That's why earlier in the pandemic, there was a lot of advice and encouragement. If you're traveling within the states, make sure you connect and understand what are those individual state requirements as you travel. So states have the liberty and the empowerment to be more restrictive than what CDC may hand down. So then the Department of Health, DOH, that is the body within Washington State that's responsible for vaccine planning, okay? So DOH, they put together what those vaccine plans will be, not just COVID, but any number of different vaccines. What happens and what is challenging, CDC or the FDA, they make these big announcements, as they've made just recently this week on the boosters and previous to that. Then the plan developments follow. So the plans are not ever in place when CDC makes the big announcement. So there's always a delay. And so I can fully understand and appreciate when CDC makes the big announcement, boosters are available, then everybody's lining up at the door, 2 minutes later saying, okay, I'm ready for the booster. That's not how it works, unfortunately. Then the states have to go to work and the respective agency within each state to develop the plan and get that communication out to all the various providers in multiple different settings to then execute. So we are in that delay phase right now. And so I know that some of you have come forward, for example, on the boosters and shared that you've been able to get some boosters at some other locations. I've heard from one of you that the Polyclinic has some boosters available now for currently the current group that has been eligible for the last several weeks has been immunosuppressed. Now that group is expanding, as you know, and we'll talk more about that in a moment. I heard some went to CVS recently, and there was mixed experiences. There was one couple who went. One has an underlying health condition qualified, the other doesn't, but said she was traveling, and so CVS said, okay, we'll give it to you. Another resident went, was able to get it, and had a friend who couldn't get it. So right now it's messy, and there are some individuals within those retail pharmacies who are very by the book. If I haven't gotten that official word that I can give a booster to this group, I'm not giving it, even though the announcement's been made. So it's hit or miss right now, and everything's very messy and unclear. And we'll talk more about that in a moment. So that's Department of Health's role. Then we have King County Public Health. Their role is to guide facilities like Horizon House when there are cases. King County will always tout what they put forth are recommendations. Sometimes it is stated as strong recommendations. Typically, facilities will follow whatever King County says because they are the public health department after all, and they have the expertise to say this is what you should be doing, it's what you recommend. Some of you have said, but is it a mandate? Is it required? King County does not mandate or require that we put forth whatever those recommendations may be when we have a case or an outbreak. However, Department of Social and Health Services, DSHS, that is a governing body that regulates our assisted living program. So we are licensed as an assisted living program for Horizon House under DSHS. DSHS has what's called a Safe Start plan. That is the COVID guidance we are required to follow for assisted living. Things from how we can do dining, how we do activities, how we manage visitation within certain specific criteria, depending on if there are COVID cases, suspected COVID cases of residents, of staff. So that's a very prescriptive plan that we must follow. For senior living communities like Horizon House, where we have the blend, we have assisted living and independent living, that gets a little messy and murky. DSHS is very clear with us that any space in your community where assisted living residents may go to is subjected to the more stringent Safe Start plan under DSHS. For example, we have one gym and one pool. Assisted living residents use that gym and pool on B1. Therefore, those spaces are subjected to the more stringent Safe Start plan. We made the decision a little while ago to separate assisted living attendants to the pool and the gym to create a little more freedom for those of you in independent living. So in other words, prior to the pandemic, assisted living residents, as able and safe to do so, could go to the gym any time of their choosing, could go to the pool any time of their choosing. Under the Safe Start plan, and in order to give you in independent living a little more freedom from that more stringent Safe Start plan, we've made adjustments. We have restricted assisted living residents to only using the gym at a certain time. So there's been trade-offs, and that is part of the work behind the scenes the virus task force has been managing, is how can we give you the most freedom within the constraints of also DSHS regulating assisted living and the common area spaces where they may also go to, because we are one community. We've worked very hard to break down this barrier between assisted living and independent living, because we want our residents who may benefit from assisted living or who may need assisted living to make that transition and still feel like you are absolutely a part of this one community. And so those are part of those tough decisions we've made to make sure residents of assisted living still are connected and engaged and not put in this box due to these COVID restrictions. So if you have more questions, because I know we are running out of time, don't hesitate to call, email me, set up a time with me. If you want to drill down more into regulation, happy to do so. I can talk all day and all night about regulations. But know that there is complexity. It is not black and white. And we have squinted our eyes on occasion, even in assisted living. We have squinted our eyes and weighing out, we are going to squint our eyes on this Safe Start plan because you know what? We believe more strongly about our residents' mental health well-being. So we have squinted our eyes. I've had some residents say, my gosh, you're going to be so black and white at the risk of. We are going to make sure our residents are safe and all of you are safe. But we are willing to take some risk, and the virus task force has, never to compromise safety. But the reality is our mental health and well-being is a paramount safety as well. And so we have balanced that very, very carefully over these last 18 plus months. So I want to assure you that we are willing to take risk, and that may include some citations, for example, from DSHS. And as long as the virus task force can all look each other with straight eyes and be okay with that, we're willing to take some of those risks. So that's the overarching DOH vaccine preparation, DSHS regulates assisted living, Safe Start plan, King County Public Health advises us, DSHS also does expect us to follow what King County Public Health recommends, so we're not completely off the hook there. So my job and my role is I navigate all of those agencies. And I am in contact with all of those agencies and interpreting all the guidance, and it is frequently changing. So that is a big part of what my demands are in terms of the COVID environment, is just managing all of their constantly evolving regulations and changes. I'm going to skip the boosters and quickly go to the employee vaccine compliance first, and then we'll end with the booster information. So in terms of employee vaccine compliance, just to go back in time, you may recall that Horizon House made the decision to proactively adopt a mandatory COVID vaccine policy. That we were a lone ranger. Nobody else had adopted this policy. I had calls from some colleagues across the city, across the water. We heard, how are you doing it? We heard legally you couldn't do that. Well, we decided to take that risk. Again, risk. And we put that into play in late May and gave our employees until September 30th to comply with our mandatory vaccine policy. Obviously, as we know now, Governor Inslee followed with a mandatory policy, and I'm grateful for that. And so we are still holding our employees to the September 30th deadline, while most others have October 18th. And at this point in time, I am thrilled to share that 95% of our employees are fully vaccinated. And that's fantastic news. Yes. 1% do have a legitimate accommodation. And we have 4% of our employees who are either unvaccinated or still have yet to give us the documentation that they are vaccinated. That 4% is a combination of on-call employees and regular employees. I can assure you we are burning up their phones, their text messages, because we don't want to lose those employees. But if they are not complying and responding with proof of vaccine or have not gotten their vaccine or qualify for an accommodation, we will sadly have to be terminating some of our employees at the end of next week. So we're still hanging on to hope. As you all know, I'm sure as you're reading in the media and all of the literature out there, there are a lot of people who are not going to be getting vaccinated by the October 18th deadline. I'm nervous because of what Mike has been sharing, what Barry and Jeff have been sharing about the marketplace being so difficult right now. And then we're going to be adding a layer on top of that potentially with a whole lot of people who, for whatever reason, are not going to be getting vaccinated by October 18th or September 30th here. So we have another layer of complexity in this big picture that I am thrilled to be able to share that 95% of our employees are fully vaccinated. So that is great news. All right, boosters. So here is what is happening. CDC, I made the comment earlier, puts out the big overarching announcements. We heard that the FDA put forth their recommendation to move to the next pool of eligible persons. So we know that currently at play, those who have immunosuppressed conditions qualify for a booster. The next group that has just come out, 65 and older, and those ages 50 to 64 with underlying health conditions. I'm in the 50 to 64, but hearing impairment doesn't qualify for an underlying health condition yet. So I don't get to get in that group quite yet. So that is currently what's at play. Many of you will remember back in January that we got this last minute call, New Year's Eve, from Virginia Mason. They gave us a gift and opened their doors, and we had about 2 days to scramble. Do you all remember that?
Yeah.
Yes. Scrambled at the last minute to get this early, amazing access to vaccines, the Pfizer vaccine. And we got a number of you through their clinics. And the first one was across the street. The second clinic, they agreed to come over here and administer their second doses here on site. Whew, seemed like last weekend. I got a call yesterday afternoon from Virginia Mason saying, we think we might have some boosters for you. Hold tight, because I just got more information. Okay, so here's where we're at. This is, as Virginia Mason told me early this morning, unprecedented times. Western state, let me make sure I say the correct term here, and I'm still getting used to bifocals too, so I'm bobbling up and down. Western State Scientific Work Group. That is the group of the body that takes CDC information and decides what are the Western states going to do with that information. Are we going to implement what CDC's just announced, or are we going to take a different course? So that group met last night. Virginia Mason is waiting for their authority. If they gave the approval last night, which they did not, we have the opportunity, just got the message, not happening today, that we would perhaps be able to get you in for boosters today from 2 to 5 p.m. Not happening. Just got the message, it's off the table for today. The CDC director, you probably heard in the news this morning, threw a monkey wrench into things, a good one though, overruled FDA saying that frontline workers should be included in this next group. rolling out for the boosters. So in other words, frontline workers should be a part of the group 65 and older, and those 50 to 64 with underlying health conditions. That is being debated now by the Western State Scientific Group. So we are waiting for that final decision. I am expecting to hear by 3 to 4 p.m. today now whether Virginia Mason will have boosters for us tomorrow, 7 a.m. to 3 p.m. If that is a go, what we are going to do, because that's still a possibility for us, unless I have not been able to get email access in here, I'm going to, at the risk of being rude, I'm going to check my phone right now and see if I have a message from VM with any other update, and I don't at the moment. Okay. So what we're going to do is we are going to open the door and we'll send out a communication after the fireside chat, inviting you to call reception and sign up for a slot tomorrow for a booster. The booster is for those of you, most of you did, who've had a Pfizer at least 6 months ago, your second dose, okay? We will be signing up 20 persons every 30-minute time slot starting at 7 a.m. with the last 30-minute time block at 2:30 p.m. Okay, first come, first serve. Phone, please do not visit reception. It's busy enough there. If we are a go, we'll send out either way communication by 3 or 4 p.m. today, possibly a little later, to let you know if we are a go for boosters tomorrow. If we are a go, we will run the clinic. We already have all the props ready. You will call reception, sign up for a time block. Do not come to reception, please, earlier than your time block. When you come down, make sure you bring your vaccine card. Some of you have lost them, I know. If you don't have your vaccine card, that's okay, Virginia Mason says. They will give you a new vaccine card. They will only record your booster information. They will not record the first vaccine information if you got it from VM. They're not going to take the time to do that, but they will give you a new vaccine card with just the booster. If you can find your vaccine card from your first and second dose, please bring that. Virginia Mason says they don't need an insurance card. My recommendation is just bring it along, just in case. You will get a number when you check in downstairs in the lobby. You'll get a number. We'll set up chairs like we had before down the promenade around the lobby, and we will monitor and call you in the order of your number to send you across the street. They've got the white tent set up out there you may have seen. That is to protect people waiting in line from inclement weather conditions, and then you'll be ushered into the clinic, just like before, to get your vaccine or booster. Let's see, consent forms, they would not be available to me till either later today or first thing in the morning. So you will each be given a clipboard to sign your consent form, Virginia Mason, and take that with you across the street as we call you over. Okay, so that will be the game plan for now. After the fireside chat, you may call reception. A reception team is positioned and ready for phone calls. After the fireside chat, we created a spreadsheet where as you call with your name with interest, then you can sign up. There is a question about flu shots. Some of you received your flu vaccine yesterday. There is no issue with receiving a flu vaccine as late as yesterday and getting potentially a booster tomorrow. However, if you have any symptoms from the flu vaccine, you are encouraged not to get the booster tomorrow, if available, and to wait at least 24 hours after symptom resolution from your flu vaccine before you proceed with the booster. If you don't get a spot tomorrow, or you just can't do it tomorrow, you already have other plans, do not worry. There will be plenty of other booster access. Virginia Mason is talking about continuing some type of a walk-in clinic. They just are being gracious and giving us the very first shot at it before they open that up to the public. So know that you still will be able to go to their walk-in clinic after whatever date. It just means you'll be in with the general public and may have to wait in line. And there are retail pharmacies, CVS, Bartell's right up the street, in time, probably in another week or so after this mess is sorted out with who all is going to be included in this next group, they will be available to start administering boosters. So it will be widely available in short order. This is just simply an opportunity for us to get over there first and get this booster in as soon as possible. That is what I have, a lot of information. Thanks for your patience. I see a question, and we're going to get a microphone to you first before we have the question. We'll come to you next.
Lori, I want to go back to what you said in the beginning about people who are asymptomatic, who are testing positive, even after the booster. I assume these people were tested because they were traveling or they were having a procedure. I mean, why would they have been tested if they were asymptomatic?
So I haven't figured out how to lip read through mask yet with my hearing impairment, but Deanna, you speak so clearly. I was able to understand you. So the question is, if one of the infected residents was asymptomatic, what prompted them to get tested? They are part of a couple where the one is symptomatic. And that led the both to get tested.
So this is really a message to all of us to be very careful about wearing a mask, because there could be many other asymptomatic people in the community that, you know, don't realize they're sick. Masks are ultra important.
Absolutely, masks are very, very important. Over the nose and the mouth, I will say that we do continue seeing a fair number of individuals at the Fireside Lounge. And we do say that the mask can be down when actively eating or drinking. When the cup is down for a half hour and there's no mask, you know, that's what we're talking about. We really need you to please have your mask on, unless I know it's not very convenient to take your mask down, take a sip, put it back up. But that's the safety measure we're talking about. And that is, Deanna, thank you. That's been tricky about this virus. You can be asymptomatic and have it and transmit it. That's what's been making this so challenging, is people are spreading it, not realizing they have it because they don't have symptoms. Yes.
So you're only talking about people who've had the Pfizer vaccine.
So the question is, are we only talking about the Pfizer vaccine? Yes. At this point in time, the booster is only available to those who had the Pfizer vaccine with the second dose at least 6 months ago. There is still talk about getting the Moderna approved for a booster. That's not here yet. And there's still some back and forth on Johnson & Johnson. So the booster is only Pfizer. If you had a Moderna or a J&J and you are asking the question, well, could I get in line for the Pfizer booster? The strong guidance is no. Don't want to mix. I see Sue right back here.
I just wanted to make the comment that I received a booster at Kaiser the other day, just by telling my doctor I'm 65 and my last booster was, my last shot was in January. So the question is, if you can't come tomorrow, and your doctor, I think, will give you a recommendation. The only other question I have is, I haven't told Horizon House, do you have some way to know, or do I need to tell you that I had my booster just so your statistics are clear?
So Sue is just commenting about Kaiser also having some boosters available. And yes, many primary clinics do have boosters available. So call your doctor's office. Again, some doctor offices are operating right now with just the pool of immunosuppressed. And I don't know if any of you who don't have a condition like that, if you've been able to get boosters at your doctor's offices. I'm not sure. Some maybe have, I don't know. Again, it's very inconsistent. And then Sue's second question is, should we be reporting anywhere that we've gotten a booster? Please let the clinic know. That would be great. See another message from Carolyn. I'm probably going to need to come closer to here.
Okay. What are your plans for supported living in the booster?
I wore good running shoes for a reason today. So the question is, when are our friends in assisted living going to get the boosters? So here is what we have learned is Mike referenced, and then I'm going to get to your question, Caroline. There's some background. Mike referenced those costs on one of his slides for testing, for N95 mask training. Funding is drying up for the COVID expenses. We have been able to get funding through state funding and through federal funding for this year and in 2020 for a lot of the requirements we've been undergoing. We had another round of annual N95 fit testing and training by a representative from Department of Health, for example. That cost money, but that was covered by the state. And some of the testing we've done in the past was covered through state funding. All those funds are starting to dry up. What we are being told as providers is you need to start planning to absorb those costs yourself, starting in 2022. The recent broad-based testing we did during our earlier cases for all of our assisted living residents and all of our staff, I'm expecting to invoice for about $10,000 for that one day of broad-based testing. This is the fear for a lot of providers across the country. Those who have been on the bubble of financial disaster, we're expecting to see over the next year, 18 months, more and more facilities closing. They can't absorb and sustain these types of COVID-related costs. Fortunately, we're building up wherever we can, knowing that we're probably going to have to take on more of these costs. That's why Mike included that. And we have built our 2022 budget to include more of those expenses that we're expecting to be with us. So for the other thing I heard from King County Public Health was, well, I called them. We've been proactively reaching out, trying to understand who can give us boosters. Walgreens, who was one of our partners back in January and February, said, not doing it. Spoke to Virginia Mason earlier, a few weeks ago, they said they weren't doing it. So I called King County and I said, for providers like us, you've got to provide some resources. Department of Health, you've got to provide us some resources. King County shared for the boosters, what they are learning is because funding is drying up, they are going to be pushing ambulatory people out to clinics, out to retail pharmacies, and doing less of providing resources to come into senior living long-term care. For assisted living, most of our residents are not ambulatory. So we are going to have to rely on a resource to come in, and we are still researching that, Carolyn, to understand who's going to help us. The delay I spoke about when CDC announces and then the state has to get the plan together, we're waiting to hear from Department of Health, what's the plan to get support into assisted living communities like here at Horizon House and some of our independent residents who maybe can't get across the street so easily for a booster. What's the plan? I anticipate we may not hear for another week or two on that. I think we've got to wrap it up. Thank you so much. Stay tuned. Tune into your communication, folks, because we may not know until 3 or 4 whether we're a go or not for tomorrow. So you've got to tune in to one of those many communication vehicles to stay tuned. Thank you.
Thanks, Lori. So we have run over our time and we have lots of info to share. So my executive decision is maybe what we'll do is a part 2, maybe next week, where we can cover the other things because other people kind of digest this information. It's been a ton of stuff. Hopefully it's been very helpful. So let's do this. Let's kind of stop right here, call it a day, and then we will take the other parts that were not included, put together something for maybe next week, and that way we have a part 2, and that way it doesn't go on too long. Peter, will that work for you for Residence Council? Okay, thank you for your patience. I hope you found it helpful. More to follow. Thanks.